Good morning. It's Raynor here. Just wanted to talk to you today about a case history form. So it's a very important thing to fill out before a person comes for a treatment. You can have it done online before the person gets there, so they can enter their details into the computer, and then you can check to see whether there's contraindications or anything that you need to be concerned about. You may need to then ask them to refer to their doctor and get a permission slip about whether they need light, medium, or deep pressure massage, or whether it's okay, or if there's anything to be concerned about. This is a standard case history form here. So a lot of the things that we like to ask people on a case history form, of course, we want their name, their details, their email. We can use the email to contact them at different stages for different things. Occupation. So occupation is going to tell them about, or tell us about, what kind of use that they're going to make of certain muscles. So for example, a massage therapist is going to probably have tight hands. Somebody who is driving a truck may have a tight right leg from pushing the accelerator, or a jackhammer operator may have tight shoulders, that kind of thing. Okay, it might also tell us about the amount of toxins that the person's exposing themselves to. So there's quite a lot we can learn from just their occupation. So one of the first things that on our case history form we ask are, do you have any injuries and or complaints at present? So that keeps it nice and open. People can then fill out, oh yes, I've sprained this a few months ago, or I've had this particular problem, I've had a tight shoulder. It's an open-ended question, so basically people can fill in what's actually bothering them at the moment. So you may then treat that problem, or you may go, oh, I'm not going to treat that because you've got a sprain or a strain or a bruise or something, so I'll avoid that area. So it can either tell you what to work on or what not to work on. Have you ever had any operations or major dental work? So in particular, we're concerned about operations within the last 3 months, but if there's anything major, we may need the doctor's permission, especially if it is in the last 3 months or a year even. And you may then find that there's certain things even with old operations that are affecting the person. In terms of dental work, a lot of dental work recently can leave the jaw very tight. With something, if they've had recent dental work, you may go easy when you're working around the jaw. Then we ask questions like, do you or have you ever suffered from any of the following conditions? Asthma. So asthma, again, is not a contraindication, but it's something that we have to be careful of. People can have an asthmatic attack while we're working on them. Sometimes the massage could bring it on. Mostly with asthma, we end up working deeper into the belly, so belly tension, as well as the legs and the arms. Massage can be very beneficial for asthma. Epilepsy, if somebody has epilepsy, then I would consider putting them on the ground, working on a futon on the floor. Okay, so that they're not going to fall off the table if they're having an epileptic fit. Massage is good for epilepsy. Sometimes don't push too much energy to the head, but calm, make sure their mind is calm, make sure they're deep breathing, and it can be very beneficial. It'll help take away some of the stress that causes epileptic fits when it brings them on. Stroke is something, if they've had a stroke, we have to be quite careful. I would definitely work with a doctor on that one. There's a lot of things saying that if people have had a stroke in the last month, that they can easily have another one. So that is something that is something quite serious, especially if it's recent. If it's 6 months or a year ago, again, maybe just get the doctor's permission and it should be okay. But if it's a recent stroke, I would be quite careful. A heart attack, again, if it's something recent, within a month, 3 months even, I would make sure you've got a doctor's permission before you massage that person, just to be safe. It's something that could happen again, especially if it's been recent. Osteoporosis. Osteoporosis is something we have to be a bit careful of. It's easy to break people's bones with osteoporosis, so doing deep massage on their back could easily break some of their ribs. So again, I would only massage an area that doesn't have osteoporosis, or be very careful and go light on the areas that had osteoporosis in that area. Varicose veins. So with varicose veins, we don't massage over the veins themselves and give them a little, couple, maybe a centimeter or an inch or so, half an inch of space where you're going to massage. You can do very gentle massage or just a very light coating with lemon essential oil mixed in with a base oil, of course, at the 1 drop per 2 mils. But in general, we would massage above and below varicose veins. With cancer, if somebody's got cancer, we don't massage over the tumor. We don't massage when they're undergoing chemotherapy. And you might want to get the doctor's permission to massage the person as well. I would probably recommend that. Massage can be very good for cancer. It alleviates pain. It helps move some of the toxins. And I personally believe that massage is very beneficial in preventing cancer. The next one is migraines. Migraines, we just have to be a bit careful of if a person has a migraine or gets them regularly. Sometimes we can bring on a migraine, especially if we're massaging an area but it's not releasing. So say, for example, massaging around the big toe sacrum band, which we're going to look at later, around the back of the neck, and just overstimulating it, it can easily bring on headaches for people that get migraines. In general, massage is good to get rid of migraines, but it usually takes quite a few treatments. Could take 10-20 hours before you start to see those headaches, go away, depending upon the quality of the massage and how effective you are at getting rid of the tension that's causing the headaches. Most headaches are actually caused by tension in my experience, although not all. Some can be allergic reactions and different things, but a lot of muscular tension does cause headaches by affecting the nerve supply to the brain, or just in general too much energy in the head. So yeah, I also recommend people drink a lot of water after a massage to dilute the toxins, and that'll cut down the number of headaches that people get after a treatment. High or low blood pressure. Again, neither are necessarily contraindicated, but something to be aware of. With high blood pressure, we don't want to massage too hard, too deep at the same time, or too fast. Just take it easy. We can go deep, but go slow. Don't want to increase the blood pressure, which could cause pressure on the heart if you're working very hard and deep. With low blood pressure, again, it's not a contraindication, but you just wanting to be careful of when people are getting off the table. They could be quite dizzy or lightheaded and feel faint. Diabetes. Diabetes is not a contraindication. My experience with diabetes is that massage can affect the blood sugar levels quite strongly, or the insulin levels, but that diabetic, it's different for everybody. So I would just let people know that massage can have that effect upon them, and that they need to monitor their insulin levels and their blood sugar levels. They're usually quite aware of whether something's going down or up. Something that can be also covered if you complete a first aid course of how to deal with somebody who's got a diabetic high or low, also how to deal with epileptic fits and things like that. So we highly recommend doing a first aid course if you are going to become a professional massage therapist. Deep vein thrombosis. If somebody's got deep vein thrombosis, also known as DVT, I would be very careful about massaging them. I would only do so with the doctor's permission, and yes, so it's often a total contraindication. Next question we ask on our form, and forms are always evolving, we can always be asking other questions here as well. But our next question is, do you take natural, recreational, and or pharmaceutical medication? Yes or no? If so, please describe. So somebody may be on some medication we don't know about. If it's got some particular side effects, for example, some people bruise very easily with medications, or it could cause blood clots to move, or anything, we don't really know. You can always get the doctor's permission if you're not familiar with that medication. There is a thing called a MIMS manual, which will tell people, it's used by nurses, which will tell people about medications. It's updated every year, and the side effects. And if you're in any way concerned about that, of course you can always use Google as well, but if you're in any way concerned about that, get the permission of the doctor that prescribed the medication to say whether massage is appropriate for the person. As massage therapists, we're not expected to be experts on medications. but we are expected to refer to an expert. With recreational drugs and things like that, again, we have to be a little bit careful. They can produce toxins, they can mask different feelings. People can use drugs, heroin and opiates, to mask emotions that they're holding down. Same with alcohol. So it can be quite scary when those emotions are brought up for them. Some natural medications. Most natural medications are fairly safe. But again, if you're not sure of something and its effect with massage, then you can ask their naturopath or somebody who ever prescribed the medication. Or you can Google it and see if you're going to get a correct answer. However, like I said, most natural medications are relatively safe. But still, if you're really not sure, check with the person. Next question we ask is, are your bowel movements regular? Yes or no? So if somebody's got constipation, where they're only using the toilet, once every 3 days or once a week, then we can do a deep or a massage on the large intestine, always going up the large intestine on the ascending colon, across and then down. So up the ascending, across the transverse, and then down on the descending colon, and you would do that in a circular movement. Okay, and that will help with constipation. Most massage will help with constipation, especially if it's deeper and getting rid of tension or getting rid of emotions. But some constipation can be dietary related or many other reasons for it. Some people can also get diarrhea after a massage. It's part of the letting go process. So it's not anything to worry about, unless it's extreme, in which case they could see their doctor. Are you pregnant and or lactating? Yes or no? So lactating means breastfeeding, or producing breast milk, I should say. So if somebody's pregnant, there's certain contraindications. Obviously, we're not going to massage the belly at any depth, maybe just a very gentle rub over the belly. When certain pressure points in Chinese medicine, like in between the thumb and the finger, contraindicated, up on the shoulder, and around the ankles. We also don't use most essential oils during pregnancy. There's only a few that are safe, like lavender in the last 2 trimesters, and mandarin, and perhaps chamomile. Next question is your menstrual cycle regular? Yes, no, or not applicable? Obviously only applicable to women during the post-puberty and pre-menopause time. So irregular menstrual cycle can mean that there's several reasons for it. It could be the nerves that are coming out from around the sacrum affecting the ovaries. It can mean tension in the belly affecting the ovaries, the uterus, and the whole reproductive system. Or it could be nutritional. Okay, so it's a couple things from a massage point of view to look out for is tension around the sacrum and tension in the belly. Okay. Next questions are, please indicate your skin type: oily, dry, combination, mature, and sensitive. So certain skin types are, like for mature skin, it can be easily, it's often quite thin, and you have to be a bit careful. I've seen it where people even rub somebody's ears or do ear reflexology and the skin can bleed. I've seen people rub excessively, so you always have to be very careful with mature skin. Even with dry skin to a certain extent. With oily skin, we may not want to use too much oil. Yeah, and certain essential oils may be affected by the skin type as well. Next question is, do you have any allergies, and are you allergic to any essential oils? Yes, no, please describe. So again, that's a simple question on if they're allergic to peanuts, then we're not going to massage them with a peanut oil, or allergic to almonds, we're not going to use an almond oil. If they're allergic to an essential oil, we're not going to use that. Next question is about their lifestyle. Do you smoke? Yes or no, an amount. So when a person smokes, it generally produces a lot of toxicity. It can produce tension in the lungs, but I've seen people have quite strong reactions who are heavy smokers to massage. They'll often feel a lot worse before they get better. They can often have headaches. They can feel nauseous. They can even vomit. I've had people give up smoking because they could feel all the toxins from the smoke come up and in their back of their throat. It made them feel quite disgusted, and then they didn't want to smoke again. I've even had it where people have given up smoking 20 years before, and when you massage them very deeply, get into the lungs, they can actually, you can smell it, they can smell it, the smoke coming out from their breath. So it shows that those toxins can sit there for a long time. So smoking is, to me, one of the biggest factors for toxicity that I've seen in people. Do you drink tea or coffee? Yes or no, an amount. People who are having a large amount of caffeine tend to often be quite tired underneath it, and when you massage them, they tend to be extremely exhausted, so they often want to rest for 10, 12 hours afterward or have a long sleep. It's bringing the body back to what it needs. So if a person is very tired and they're using caffeine, the massage will actually process that caffeine quite quickly usually, and then they'll be feeling very tired, and then they just need to follow what their body says, so they need to rest. Large amounts of caffeine can, in Chinese medicine, deplete the adrenal glands, which can lead to lower back pain as well, which would be treated by working the legs and just generally bringing the person back into balance where they're not dependent upon that caffeine. Do you drink alcohol? Yes or no? So large amounts of alcohol can affect the liver, as we all know. It can also be repressive on emotions, so people could have a lot of emotions underneath that they're using alcohol to numb out. There's been, in Chinese medicine, the liver is associated with the repression of anger when it's what we call a tight liver. So sometimes people who are drinking a lot can have underlying anger issues as well. So that's something we need to get people to breathe into and release, but not aiming it at the person. I encourage people either to hit a pillow or to scream, but not at the therapist who's doing it. Okay, so that's something we'll talk about later when it comes to emotional releases. How many hours do you take time out for yourself per week? So what this question is telling us is, does that person actually take some time to spend with themselves, going on their inner journey, being, looking at what's going on inside their mind, inside their body, emotionally. People who take very little time out in their daily life will find that massage can be quite confronting because they're having to look inside themselves. The massage is bringing awareness back to what's going on inside. And if they are using different substances to numb out what's going on, or they're using addictions, either addiction to work, or addiction to TV, or addiction to whatever it may be, drugs, or people, or codependent relationships, or many different things that people become addicted to as a way to not go inside themselves, then you can expect more emotional reactions to occur when you're actually treating them, because that will be a time where they have to confront themselves. Okay. Which best describes your diet? Heavy meat consumption, fast food, whole foods, vegetarian or vegan, or combination? Okay, so the more toxins a person has in their diet, again, the more likelihood of a healing crisis to occur where they feel nauseous. The body can be affected by different things that a person's eating. So if they're eating a lot of junk food, one, they're not getting the nutrition that they need. Two, they're getting all these toxins. When I massage people on junk food diets who are eating out at fast food restaurants or processed foods a lot, they tend not to handle much pressure. They tend to have a lot of toxins, and you just have to work easily, go gentle on them many times. I find the strongest people tend to be people that are on a whole food vegetarian diet. They can usually handle deeper pressure, but it's all an individual thing as well. We've obviously got all the hormones and different things that are in a lot of the factory farm foods, which are also not good for people and produce toxins, and the antibiotics and all sorts of different things that we go into in our vegetarian and vegan whole food nutrition courses as to why that kind of diet is the best one and the healthiest one, and the one that has the least toxic residue. Next question is, which best describes, do you do regular exercise? Yes or no, and the number of hours. So people that exercise a lot tend to be able to handle deeper massage, and the exercise itself moves a lot of their toxins. So even if they're having a more toxic lifestyle, because they're exercising a lot, they're moving that toxins, or they're moving those toxins. So the worst kind of person, in my opinion, to massage is somebody that's sedentary, on a junk food diet, that's smoking, drinking a lot of alcohol and soft drinks and things like that. And as soon as you start massaging, there's so many toxins get brought up for that person. And it takes a long time, and there's a lot of healing crises as they have to face the effects of what they've been putting into their body and not moving and getting rid of. So doing regular exercise does really help with the moving of the toxins and strengthening of the muscles and that sort of thing. Sometimes people can have muscle soreness from their physical activities or injuries as well, so that's something else that we can learn from that question. Now, one of our last questions here is basically describing more their emotional state. So we ask the questions, do you suffer from any of the following? Fatigue. So somebody who's suffering from fatigue, generally either they're not getting enough nutrients in their diet, or when they have a lot of tension in their body, it restricts the natural flow of their life energy, which will produce fatigue. So somebody with fatigue, I would expect to be quite tight. As I say, unless they're like anorexic or something where they're just really not getting the nutrients from their food. Next one is stress. So stress is a general term, but generally speaking, when somebody circles stress, I think emotional stress and physical tension, the two accompanying. So I'm looking at abdominal tension, I'm looking at tension around the head, and just general tension throughout the body. Rage, when somebody circles rage, then I'm looking at wanting to encourage them to let that rage out if we access it during the massage. But again, as I mentioned before, not at the practitioner. They could scream, they could hit something to let that rage out. Underneath rage often is sadness, so they might go have a whole lot of rage and then start to cry. But it's better out than in. And it's great if they circle that and they acknowledge that. A lot of people have rage, but they don't acknowledge that. They're more, like a passive-aggressive kind of person. It's much easier to deal with somebody who recognizes they have rage than somebody who doesn't. The next one is anxiety. So anxiety, there tends to be a lot of tension in the belly, tends to be the energies rising to the head. We're going to want to encourage them to do a lot of deep breathing and also let any emotion out. People often have fears. The biggest one is fear of dying. Next one is fear of social ostracism. Fear of people thinking that they're strange or weird or anything and not being accepted. And these two fears in particular underlie a lot of people's sort of base way of being, if we could describe it, and that then causes anxiety. So those fears may be confronted during the treatment if the person is willing to, and that will be done through deep breathing and then massage, just accessing all the emotions that are in their body. So massage is a fantastic way of dealing with anxiety if the person is wanting to go and deal with their underlying fears. Obviously, some people may need to deal with fears, especially like fear of dying or fear of social ostracism, by other practices like meditation or spiritual practices, or coming into peace with yourself and the effects of time, or however it may be. The same with things like phobias. Often related to anxiety, but the same basic principle there is massage can often help with that sort of thing. It can be some emotional experience that people have had when they were younger that they're still holding on to that's creating the phobia. So that might be accessed during the treatment. The person needs to just breathe into it and let it go. Depression. So with depression, often it can be combined with things like fatigue. It can be combined with just not actually being true to what we call your dharma in Ayurveda, which means your life path. Some things can be holding the person back, like maybe they feel they have to be something to somebody else, or they can't be true to themselves, or whatever it may be. Massage can often help with that. by getting rid of the tension in their body. There'll often be a lot of belly tension, but there can be toxins sometimes. Flower essences, in my opinion, are also a great adjunct to massage when dealing with things like anxiety and depression, phobias. We have a whole separate course on those. Same with things like postnatal depression. Again, massage can be very beneficial along with other forms of treatment. Nervousness, the same sort of thing as we dealt with anxiety. Just again, getting them to deep breathe. Deep breathing is very, very powerful, and that will get rid of all this nervous energy that some people have. Okay. Anger, the same as, it's like a milder form of rage, so we need the person to, it's great that they acknowledge it by circling, then we just need them to actually do a big scream, and I won't scream because when I scream it's very loud. But basically you want them to do a very loud scream or whatever comes naturally to them in order to release that anger, and sometimes maybe hitting a pillow, as long as it's not directed at a person. Okay. It's quite an intense thing, getting rid of anger, but people feel so much better afterward. Menopause, so some people are finding when they're going through menopause that they feel different hormonal imbalances, or it can be other issues to do with just the passage of time and getting older, or all the things I was mentioning before, fear of dying, fear of old age, even can be all mixed up with the obviously hormonal things and the hot flushes and the different energies that are going on. So massage can be very beneficial, as well as flower essences, as well as Ayurvedic herbs like shatavari, different things that can be very helpful. Addictions. So we want to know about addictions. Again, usually addictions are masking some other problem that's deeper, but the substance to which a person can be addicted to can also, be causing toxins in their body if it's a physical substance, or can be trying to take them away from, again, going within themselves and finding happiness within. So they're finding happiness from something else because they're feeling empty inside themselves. Again, massage will actually bring all these issues to the surface. But again, they could be treated better by things like meditation, or by spiritual practices, or by flower essences sometimes as well, in combination with the massage. Mood swings, same sort of thing as, get rid of the tension, it'll calm the person, center them, and get them to deep breathe. All of these will add to a deeply centering feeling, which will stop mood swings. But again, I would recommend massage in conjunction with making sure that, first of all, the person's nutrition is good, because sometimes too much sugar in a diet can cause a lot of mood swings, artificial chemicals and different things as well, preservatives and colorings and things. So I would make sure that they're not having those. And then I would also consider flower essences. Insomnia, so a lot of stress and tension often leads to insomnia. It's like the energy rises to the head. So massage can help calm that down, especially with deep breathing and massage, assisted belly breathing, calming the mind, so face and head massage, even getting into the hands and feet. I've had a lot of people who suffer from insomnia say after a good massage they've slept the best they have in years. But usually it takes quite a few sessions to really get rid of it. And then it takes ongoing maintenance massage. Anorexia. So again, anorexia, we would need to look at the underlying emotional issues. Is it that people aren't comfortable with who they are? They're over-identifying as the physical body rather than understanding that they're beyond this physical. So again, massage can help deal with some of those underlying emotional issues. Usually they're actually stored in the abdominal area, so there'll be tightness in the abdomen, which will be coming from the feet. Getting people to breathe, just letting go of emotions. There could be anger there, there could be sadness, all sorts of things. Again, I would probably treat that in combination with flower essences. And the last one is premenstrual tension, or PMT, or PMS, premenstrual syndrome, as some people call it, depending upon the country that you're in. So again, belly tension can be there with PMS. We can find tension in the around the sacrum and the muscles around there and the nerves that are coming out of there, as well as, of course, the tension that leads up to that coming from the feet and the legs. So that's where I would work on from a massage point of view. Definitely really get that tension out of their legs, work it out from the feet, the toes, and then make sure that the sacrum is loose and not tight. Maybe some side twists and things like that might be good. The side position is particularly good to work into around the sacral area. And then I'd also work into the abdomen. And I've seen many, many cases of PMT, even infertility and different things treated with good Raynor massage. So after that, we basically get people on a case history form basically to sign what they've said to be true. We make a little disclaimer that we can't, obviously we do the best we can. But a case history form is obviously it's an information document, but it's also like a contract. It's like a legal contract that they're telling you everything. It's always good to ask, are there any other conditions or health conditions that you have that I should be aware of? Because if there was ever a case where it went to court for something, if the person has claimed that, oh, you should know something, well, the only way you've got a documentation is of what they've told you is this case history form. I would get people with a case history form to check it every time and maybe sign on the back and just say, yes, everything is the same, because people could become pregnant, people could have operations, people could have injuries, people could develop different conditions during the time that you're seeing them. You would then want to keep a case history form filed either on a cloud, online, or in a filing cabinet for about 7 to 10 years after you have finished treating the person. And then you would keep that with any doctor's permission slips in a file. And then also maybe some SOAP notes, which we'll talk about in the diploma course as well. So that's pretty much how a case history form works. There are many different examples online. You can adapt it to make it your own. But the basic idea of a case history form is to get as much information about a person's health as possible, especially in regards to how massage is going to help them. Or if you're a naturopath or adding other modalities, then even what other modalities can help with. All right, so thank you very much for hearing us today, for listening, and look forward to seeing you again.